Every time you go to the doctor's office, you get your blood pressure taken. And they tell you two numbers. One we call the systolic, and the other we call the diastolic. What do they mean, and which is more important to control? We're going to get into this coming up. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. In today's video, we're going to be diving into what your blood pressure numbers mean and what you should do about it. So let's talk about what your blood pressure numbers mean. As I said before, there are two numbers that we see when we measure blood pressure. We have the numbers on the top, which we refer to as the systolic blood pressure, and the numbers on the bottom we call the diastolic pressure. Your systolic or top number refer to how much pressure your heart is exerting on your blood vessels as it contracts and pushes the blood out of your heart. The bottom number, the diastolic, refers to how much pressure stays in the blood vessels while your heart rests between beats. We care about blood pressure not because of what any specific number shows, but what effect that number can have on your body and your overall health. High blood pressure is one of the most important factors that puts you at risk for having damage to your arteries, putting you at risk for a heart attack, stroke, as well as other organ damage like kidney failure. See, what happens is over time, the more your blood pressure is elevated, it puts strain and stress on your arteries. You combine that with the aging process where the arteries get stiff and it compounds the problem. All of this causes damage to the lining of the blood vessels, which makes them weak. Helps form things like plaques, which can rupture, causing that heart attack and that stroke. According to the most recent guidelines, normal blood pressure is considered a systolic or top number below 120, with a diastolic or lower number below 80. Blood pressures between 120 and 129 over 80 are considered elevated, and those with a systolic over 130 and a diastolic over 80 is considered high blood pressure. And by that, they mean that those are the realms that you should start to become at risk for heart disease. It doesn't necessarily mean that these are the levels you need to take medication, but you do need to work on and address it with your doctor. Ultimately, the answer is going to be both, but this has been a moving target over the years. 50 years ago, it was felt that the bottom number was the best measurement of your health. Over time, and with more studies, we saw that the top number, or systolic blood pressure, seemed to be a more important predictor of health. That has been the prevailing thought for quite a while, and has been the major focus of most doctors. More recent studies, however, have added more clarity to this question, showing that indeed, both numbers are important. The emphasis still leans a little more towards the systolic, however, you shouldn't ignore the diastolic. Well, frankly, there isn't one best way for everybody. We should all primarily focus on our efforts of eating healthy, exercise, stress management, and maintaining a healthy weight. Those are the principal things that you should be working on each day. But sometimes it's not enough though. Sometimes medication is necessary to get your blood pressure under control and decrease your risk. Now, sometimes genetics is a major factor and you already live a healthy life, so it's absolutely necessary. The best approach in getting your blood pressure controlled is doing all you can to change the things in your life that are affecting it, and working closely with your doctor on other options when that isn't working. High blood pressure is high blood pressure, no matter what is causing it. If your top number is high, it's bad. If your bottom number is high, it's bad. Get going on treating it to give yourself the best chance of having a healthy life. Don't fall into the trap, though, of thinking that you can just take a pill to fix it and ignore all the things in your life that are causing this to happen. But also, don't fall into the trap of thinking that all medication is bad and evil when it very well could be one of the things that could save your life. So that's your answer to what those numbers mean and which is more important. Hopefully you found it to be helpful. If you did, make sure you give this video a like and share it with your friends. It helps our channel to grow and reach others that may need this in their life. And don't leave without subscribing, hitting that notification button so you don't miss out on any of our future content. I really appreciate you taking the time to watch today and look forward to meeting with you in the next video. If you didn't get enough, go ahead and click here to learn about some of the things that you can do at home to control your blood pressure naturally. So until then, take care, and we'll see you in the next video.